Let's look at some principles of muscle action. The first principle is that when muscles cross a movable joint, they will act on it. That's very important. Now let's look at this picture here which I have drawn. I've kind of drawn three pieces of wood and they are joined at these points by hinges. And let's say we have a string which goes anterior to these joints and another one which goes posterior to these joints. Now if you were to pull on this string so that it moves upwards like that, what will happen is it will pull on these two pieces of wood, and this is what is going to happen. So you can see this bending motion that occurs. This kind of a bending motion is known as flexion. And the general principle is that when any muscle crosses in front of a joint, it will cause flexion, as you can see in this part here. Of course, there are certain exceptions. Then the other is, if you were now to pull on this piece of string which lies posteriorly and crosses these joints, then you're going to pull this way, then the pieces will straighten out, and that motion of straightening out is known as extension. And what we see from this picture is that any muscle crossing joints behind or posterior will cause extension. What you also notice is, since both strings cross both these joints, a movement occurs at both these joints. Now let's look at a PowerPoint and look at some of the images that we have in the PowerPoint and work out these actions. So let's look at the first one which we talked of, which was here. So here we said that we have this muscle which crosses in front of the shoulder joint and in front of the elbow joint, and when it does that, what it's going to do is it is going to pull on the bones of the elbow. So it's going to pull them upwards this way. So these bones will kind of move up this way. And it will also, because one point always remains fixed and the other point is the one which moves. So let me show it to you this way. So this is the fixed point which is up here at the scapula, and the movable point is down here at the radius. So we have, let's say that this is the arm this way. So this is the shoulder and this part here is the elbow. So what it's going to do is it's going to pull this up. So you can see that there is flexion at the elbow. It's also going to cause flexion at the shoulder joint because it crosses the shoulder joint. Now flexion at the shoulder joint is not a bending motion. Instead, what happens is it causes this bone, the humerus, to move across the body. So the position actually will be like this. So this is how it's going to be. So there is the movement of the shoulder across the body, which is known as flexion, and there is flexion here at the elbow too. So this is the action of the biceps. This is opposed by the triceps, which lies posterior, and it will cause extension at the shoulder and at the elbow. Now let's look at some other actions that we see, and the other actions are abduction and adduction. Now when muscles have, so we have adduction and abduction. So when muscles have a medial attachment and a lateral attachment as the pectoralis major, so its medial attachment is all along this part here, its lateral attachment is on the humerus. When it contracts, it's going to pull the humerus closer towards itself, which is this way. This part cannot move. You cannot move the rib cage towards the humerus. You can only move the humerus towards it. So when it does that, it's going to pull the humerus closer towards itself, and so it's going to cause adduction. Since it's crossing the shoulder joint, you can see here is the shoulder joint. This muscle crosses the shoulder joint. Its action is going to be at the shoulder joint. The opposite movement, which is abduction. Abduction occurs when muscles arise from a proximal attachment and they go down to a distal attachment. So it's from above downwards, as you see here in the case of the deltoid. So the deltoid has an attachment all along the scapula and the clavicle. So there's the scapula and the clavicle. So it arises from both these bones, goes all the way down towards the humerus. So here again, it's crossing the shoulder joint. When it contracts, you can't pull the clavicle or the scapula towards the humerus. You can pull the humerus towards the scapula. So what it's going to do is it's going to act this way. And what it does is it causes the arm to go out this way. So you can see, so this is the muscle up here. So it's going to cause the arm to move away from the median plane, so it will cause abduction. So muscles which have a proximal and a distal attachment, they're going from above downwards. See, all muscles of course have a proximal and distal attachment, but when they cross a joint from above downwards in this fashion, as you can see laterally, so when they cross a joint laterally with a proximal and a distal attachment, they will cause abduction. So that's the action of abduction. And let's look at the other principle, which is acting on joints where they cross many joints. Now look at this big muscle up here, which is the flexor digitorum superficialis. It arises from the medial epicondyle of the humerus and the ulna. Since it's arising from the humerus, it obviously has to cross the elbow joint. It crosses it in front, which means it will flex the elbow joint. Then you can see it's going down here, crossing the wrist joint anteriorly. So it will act on the wrist joint. Again, it crosses the wrist anteriorly, so it will flex the wrist joint. And then you can see up here, it crosses the metacarpophalangeal joint, and it will insert on the middle phalanx. So it crosses the first interphalangeal joint, also called the proximal interphalangeal joint. Since it crosses so many joints, it will flex all these joints because it crosses it anteriorly. So it will flex the elbow, it will flex the wrist, it will flex the metacarpophalangeal and the proximal interphalangeal joint. Look at the flexor digitorum profundus. Now this, as you can see here, arises only from the ulna. It crosses the wrist joint and it goes way down till the distal phalanx. So it will not act on the elbow because it does not cross the elbow. It's arising from the ulna, not from the humerus. So it will not act on the ulna and on the elbow joint. It will act on the wrist, flex the wrist, and then flex all the joints of the digits. So not only the metacarpophalangeal but both interphalangeal joints, since it goes right up to the distal phalanx. It's going right up to the distal phalanx. So what it will do is, so imagine that this is the metacarpal bone, this is the proximal phalanx, this is the middle phalanx, and let's say this is the distal phalanx. It crosses all these joints, so it's going right up there. So it is going to act on this one, and this one. So that's how this muscle is going to act. Now let's look at lower limb bones. Again, if you look at the adductor group of muscles, they have a medial attachment to the pubic bone, pubic part of the hip bone, and they go towards the femur. Since they are going again from medial to lateral side, the pubic bone cannot move laterally. So what they are going to do is they're going to pull the humerus towards the pubic bone and hence cause adduction. So the femur. So they are going to do this. So they are going to cause the femur to move medially, which is adduction. So you can see that that's what they are going to do. This muscle up here, you can see this is the iliopsoas crossing the hip joint in front. When it contracts, it crosses the hip joint in front. So when it contracts, it's going to again pull the femur upwards like that. So the femur is going to move up that way, which is a movement of flexion at the hip joint. Now this general principle changes when we come from the knee downwards, when we approach muscles from the knee downwards, because here if you notice, and this is because of the way the body developed, from the knee downwards the folding movement occurs behind and not in front. So any muscle which crosses the knee or the ankle or any of these joints anteriorly, what it's going to do is it's going to extend the joint. But any muscle which crosses it behind will flex the joint. So let's look at it this way. And if you're looking at it from the side, so let's say that's the thigh and that's the knee and that's the foot up here this way. So any muscle which is crossing in front, like the quadriceps femoris, which is this muscle here, when it contracts, it's going to straighten out the knee. So it will extend it. Any muscle crossing the knee behind, for example, the hamstring group of muscles, when they contract, they're going to pull your leg towards your thigh. So that means now your leg is going to be this way. This way. So they are going to cause flexion at the knee. So the rule changes as far as flexion and extension is concerned, which is that it causes any muscle which crosses the joint from the knee downwards in front causes extension, anything crossing behind causes flexion. Similarly, these muscles which cross the ankle joint in front, instead of calling it extension, we call it dorsiflexion. And any muscle which crosses behind the ankle up here, we call it they cause plantar flexion. So that movement is known as plantar flexion. Now here again, if you look at some of these muscles. So look at tibialis anterior, and it arises from the tibia. So that means it's not crossing the knee joint. In order to cross the knee joint, it has to arise from the femur. So it's arising from the tibia. It passes down and attaches up here on the tarsal bones. So it attaches up here on the tarsal bones, which is here. So it attaches on the tarsal and the cuneiform. So what it does is it only crosses the ankle joints. So therefore it causes dorsiflexion. On the other hand, this muscle, extensor hallucis longus, arises from the fibula, crosses the ankle joint, and then goes all the way till the distal phalanx of the big toe. So not only is it going to dorsiflex at the ankle, but it is also going to extend the joints of the big toe. So that's how you work out the actions.